Hi, my name is Barb Schreiner, and I'm a clinical nurse specialist and independent education consultant. As diabetes care and education specialists, we work with our clients and people with diabetes from a holistic perspective. We increasingly address and tend to the cardiovascular health of people with diabetes. So it's important that we stay acutely aware of the risk of severe complications that people with diabetes and people with heart disease face from diseases that are preventable with vaccines. Even if your clients manage their diabetes and heart disease well, the physiologic factors linking these diseases, such as inflammation, cholesterol levels, blood pressure, and blood glucose, can create an environment in the body that can make it harder for the immune system to fight infections. Not only does this increase the risk of infection for people with diabetes and with heart disease, it also increases the chance they'll develop severe consequences from any infection they develop. At a minimum, vaccinations are an important strategy to make sure your clients maintain proper blood glucose management. Being sick places metabolic stress on the body that can raise blood glucose, and anyone who's been sick also knows how appetite can be affected, thus complicating blood glucose management even further. But the complications don't end there. Complications from some vaccine-preventable diseases, such as the flu, can be as severe as increased risk of heart attack, hospitalization, or even death. The CDC reports that for people with diabetes or heart disease and people who have had a stroke, there's an increased risk of developing serious complications from flu or having serious flu outcomes such as hospitalization or even admission to the intensive care unit. And a 2018 study found the risk of heart attack was 6 times higher within a week of confirmed flu infection. In fact, almost half of adults hospitalized with flu in the CDC's Flu Hospitalization Surveillance Network last season had heart disease, and nearly 1/3 had diabetes. The evidence makes it clear that clients with diabetes and heart disease are vulnerable to serious complications from vaccine-preventable diseases. However, we have a solution to these grave statistics within our advocacy for vaccines. Not sure how to begin promoting vaccines? An appropriate first step for diabetes care and education specialists in any practice setting would be to work together with your colleagues and other members of the care team to assess the immunization status of all your clients, especially adults with diabetes and heart disease. In your assessments, check on your client's vaccination status for each of the following 5 vaccines: influenza, hepatitis B, zoster or the shingles vaccine, pneumococcal, and TDAP, that is tetanus, diphtheria, and pertussis. By preventing flu infections through an annual flu vaccination, we can help lower the rates of cardiac events among people with heart disease, especially among those who had a cardiac event in the past year, and we can reduce hospitalizations among people with diabetes. Recommend this vaccine every year around the start of flu season in October, and then assess for anyone missing their flu shot throughout the season. Hepatitis B vaccination is also important for people with diabetes who have a higher rate of hepatitis B infection due to their increased risk of blood glucose monitoring and their exposure to devices such as lancets, fingerstick devices, and insulin pens. While a hepatitis B vaccine is recommended for any adult under the age of 60 as soon as possible after their diagnosis of diabetes, a healthcare provider can use their discretion for this vaccination in anyone older than 60. To reduce the risk of shingles, which can bring about painful rash and long-term nerve pain and even impaired vision if the face is affected, recommend the zoster vaccine. The CDC recommends this vaccine for anyone over 50 years of age. CDC also recommends pneumococcal vaccination for adults living with diabetes or chronic heart disease to help protect them against serious pneumococcal infections like meningitis and bloodstream infections, as they can face an increased risk of acquiring pneumococcal disease and complications from these infections. Finally, all adults who haven't been previously vaccinated with TDAP, including people living with diabetes or heart disease, should get the TDAP vaccine, followed by either a TD or TDAP vaccine every 10 years. Both vaccines protect against tetanus and diphtheria, but the TDAP also helps protect against pertussis, also known as whooping cough. Most adults already believe that vaccines are important to support their health, so taking the time to remind them of these 5 recommended vaccines can be the nudge they need, and it also further establishes your role as a valued and trusted source of information. CDCES has compiled more information and resources to help you promote these vaccines among your clients with diabetes and heart disease. Go to diabeteseducator.org/vaccines to access these resources and encourage your clients to talk with you or another healthcare provider about vaccines today.